Welcome to the first episode of Illuminated by Morehouse, a new conversation series through which the college brings a discourse from its hallowed halls to the digital world, sparking intellectual conversations, challenge perspectives, and make an impact. After more than a year apart, Morehouse College is excited to welcome students back to campus this August. In anticipation of the return, the college, alongside our Atlanta University Center neighbors, Spelman College and Clark Atlanta University, outlined health and safety requirements to best protect our community against the COVID-19 virus. While I didn't get to have the junior year I envisioned, I'm eager to reunite with my brothers on campus and welcome the freshman and sophomore classes to the distinctive Morehouse experience, both in the classroom and on the yard for the first time. Now, it is no secret that the COVID-19 and the COVID-19 vaccines have been an ever-present topic of discussion since early 2020, with plenty of contradictory information floating all around us. Today, we are looking to set the record straight and hopefully relieve any concerns by hearing the facts, answering frequently asked questions, and debunking a few myths in the process. Without further ado, I am Olamide Fagbamiye, a rising senior, sociology major, and public health minor from Douglasville, Georgia, by way of Nigeria. I'll be your Illuminated host today. We have the pleasure of speaking with Dr. Frank Jones and Dr. Harold Bennett. Dr. Frank Jones, can you please introduce yourself?
Well, thank you, first of all, for allowing me to be on this panel or have this discussion. My name is Frank Jones. I'm originally from Augusta, Georgia, proud member of the class of 1985 of Morehouse College. I am a general surgeon, a trauma surgeon, and a critical care surgeon. And currently I am adjunct faculty at Morehouse School of Medicine, adjunct faculty at Philadelphia College of Osteopathic Medicine, and I also am a wound care surgeon at Piedmont Fayette Hospital. I also am the founder and president of Pre-Med Solutions, and that's something I'm really proud about. It's a mentoring program for underrepresented minority pre-med students. So thank you again for having me.
Yes, sir, thank you.
I am Harold Bennett. I am originally from Winston-Salem, North Carolina. I am a proud graduate of the North Carolina Agricultural and Technical State University in Greensboro, North Carolina. I did my PhD in religion and ethics at Vanderbilt. I did my graduate degree in philosophy at Georgia State. And I also did my graduate degree in divinity at the Interdenominational Theological Center here in Atlanta. I have been at Morehouse for 27 years. I am the program director for philosophy and religion. My publications are in religion, ethics, religion, religious text, religion, law, that kind of thing. I also I have a radio show that comes on here in Atlanta on Wednesdays that's called Pentecost for Life, where you explore the relationship between Pentecostalism, the Pentecostal church, and the Black experience. I'm so happy to be a part of this conversation, and I am looking forward to how it's going to unfold. Thank you again for having me.
Thank you for being here today. So we're gonna jump straight in. So first question I would like to ask is, what is the COVID-19 virus?
Well, COVID-19 is short for coronavirus. And that's a group of viruses that's been around for a long time. The common cold is a type of coronavirus, but this one, it's a novel, meaning a new coronavirus, and it was found in 2019. And so that's why it's called COVID-19.
All right, definitely. Can you talk a little bit more about how people that look like us are impacted by this virus?
Well, that's what's been so disheartening, is that we are really the most impacted and really affected. And I don't know if you all can remember, but when this first came out, we used to talk about how Black people don't get COVID-19.
Yeah.
We didn't seem to have any of us really getting COVID-19.
Yeah.
And then all of a sudden, we flipped the script. And it really has affected us.
Right.
And the reason that it's affected us is because even before now, it's really shedding light on the disparities that have always existed in healthcare and some of the chronic diseases that have affected us more in our particular population. And so when you add that, when you add the hypertension, when you add the diabetes, when you add the respiratory diseases, when you add some of the other illnesses that are really rampant in our community, add a pandemic type virus to that, and it's really just been ravishing our community. And not just that, it's not only that we get it at a higher rate, but we die from it.
Right.
And so we really have to do everything that we can to help our community.
Yeah, definitely. So in understanding like how it's impacting us on that social level and us specifically, can you talk about those physical impacts as well? For like
Some of the signs and symptoms.
Right.
Yeah, so it's really like, well, first of all, one of the biggest problems is that it can be asymptomatic.
Right.
And that's why this has been such a dangerous disease, is because you might feel fine and not even know that you have it, yet you still can go and spread it to other people.
Right.
But when you have the symptoms, it may be very mild or it may be severe. So it's really just some of the same symptoms as having a cold, common cold. Cough, cold, stuffy nose, sore throat. One of the things that we found out early in the disease that was really odd is that you can lose your sense of taste and smell. It's just gone for a while. I mean, in fact, that happened to my youngest son. He just lost his sense of taste and smell for a month.
Wow.
And so that has been one thing that's been kind of common. But some of the other things, like you may have diarrhea, fever, chills. So really, we're finding out that all types of symptoms can really be present in people that have COVID-19.
Right. Definitely. So with understanding like that it's been such a hard year for everyone, starting from 2020 up until now, how do you think the conversation of vaccines should continue to move forward for us?
It's so important. It's so important to have the conversation, first of all. And there's many reasons why people are not getting vaccinated. I'm sure we're going to get into some of those. But it's so important because it can save your life.
Right.
One thing that we're pretty sure of, when I say we, meaning the medical community, is that 99% chance that you're not going to die if you get the vaccine.
Right.
You still may catch the disease, you still may have COVID, you still may get sick a little bit, but severe illness and death doesn't really occur if you get the vaccine.
Right.
And so that's why it's so important in our community, especially since we're dying more and at a faster rate than other communities. It's so important for us to get the vaccine. I mean, it can save your life.
Right.
And so we have to have conversations like this, you know, where we talk to groups of people, but it's also very important to have those individual conversations,
Right.
you know, with your minister, with your doctor, with your teachers, whoever you have trust in. It's important for us to have conversations with those individuals.
I definitely agree. Dr. Bennett, what's your thoughts on that?
Well,
conversation?
I think the reasons this whole COVID phenomenon is having such an impact on the African American community. Some of the theological kinds of underpinnings would be, you know, on the one hand, you call it theological, philosophical kind of stance. First of all, and there's a reason for it. A lot of us simply have trust issues, meaning we're not comfortable with doctors, with the medical industry. And that's, you know, you think about our history, and I think Dr. Jones, Frank, can talk about that whole experience, or that whole epoch, that whole phase in the life of us, where, and when I say us, I'm talking about us, people of African descent here in the diaspora,
right.
that even with the enslaved Africans, you know, what happened with their bodies, going on down to Tuskegee, going on down to some other kinds of interesting things. The Harriet Washington piece that we was talking about earlier, you know, medical apartheid, kind of chronicles that kind of thing. So on the one hand, I do think that, and Frank was really good with identifying some of the medical kinds of biological, physiological things that clear space for our being, you know, catching COVID-19, if that's the right term to use. But there is a trust issue where some of us are just not going to get the vaccine because we just don't trust the healthcare industry. That's one piece. Then there's a very interesting theological kind of current that flows here. I want to say a theological kind of piece On the one hand, there are some who are going to say, well, you know what? I believe in divine healing. I don't need to get a vaccine. God gonna heal me.
God, right.
You know, I mean, you know, you don't fool yourself. There's a lot of us in our community who are going to talk about divine healing in the sense that that precludes, you know, any kind of assistance from doctors. So that's a very serious issue. The whole belief in divine healing. Even it could even go as far as to talking degree about autonomy and decision making. When I say decision making, some will say, well, you know what? I'm not getting a vaccine because the Holy Ghost spoke to me, and God told me don't get it. You know, so you got people who are going to say, I mean, there are a lot of reasons I would say that we're not getting them. On the one hand, a trust issue. Right. I just don't think we can take that off the table. Right. And I think that that's founded. Then you have these theological kinds of pieces that come into play about believing in divine healing, having this intuitive kind of direct, kind of immediate kind of conversation with God, and God told you not to do it. And for that reason, I'm not going to do it. And then there's other pieces, like I said, that theological piece, I would argue, positions us to become victims of this disease that has wreaked havoc in our community.
Definitely.
And that kind of thing itself, I do think, there are some consequences to that. I mean, whether they're personal or corporate. And when I say corporate, you choose because God told you not to get vaccinated or whatever. But keep in mind, there's also the chance that you could be infected and you could affect somebody else.
Right.
So now an ethical question would be then, you know, what is my responsibility to the community? You know, what is my responsibility to the community?
I was gonna say, one of the things that I would like to see, and I haven't really seen it on an organized level, is the clergy, is the ministers and everything getting together,
right,
saying exactly what you've been saying. Right.
And I think, like, to that point, and you definitely talked about it a lot, but on this topic right now, so can you describe more on, I guess, better ways that we could mobilize in our communities? Like, I know from readings and like different research and things I'm doing on right now in the summer is that the best way to get in contact with communities is to reach those pillars in those communities. And we all know for majority communities, religion is a very big staple. And we know for us, the church is typically that religion, the Christian church. And for us, as you mentioned, like, we haven't seen a lot of churches come together. We've seen them do maybe in their own setting and during church and stuff like that. But what ideas or what do you think is going on of why not, you know, other ways that the vaccine and discussion could just be mobilized in the community?
One of the things I said kind of half jokingly, but I'm half serious too. Probably what the fastest way you could get us as Black folks to get the vaccine is to open the churches up and say, to get back into church, you got to be vaccinated.
Can't even lie to
you. If you said, we're going to open up the doors of the church, but you got to be vaccinated.
Gotta be vaccinated.
It would be a whole lot of people getting vaccinated.
It's true.
Now, I understand all of the issues surrounding that, you know, but on some level, I think, well, you know, maybe we need to think about that.
Right.
You know, we've proven that you can safely congregate. You still have to pay attention to your social distancing, may still have to wear masks, but at least we could come back together, you know, and have church. But you got to be vaccinated.
But that's a nerve that I think, you know, can be touched, understanding like their position in place. Like, they are pastors, so they understand the idea of, in a certain context, of exclusion and inclusion. They realize that in certain contexts, in certain scriptures, it mentions if you do this and that, you're in. If you don't, you're out. So if we're here at the table, we're talking about something that's saving lives on earth, the vaccines, you know, I think they should be more reluctant to being open to it. But with that being said, how else do you think, you know, the vaccine can mobilize outside of the church? You know, I've read in places such as like the barbershop. Like, what other community centers do you think could be a partner in mobilizing the vaccine?
I think everybody needs to partner in this. I mean, there's not one area that needs to be excluded. But again, I think it's important to have those individual conversations, but group conversations are important as well. So we started, as part of the Atlanta Medical Association, we started this series, and it's called Ask a Black Doctor. And that's where people like us get a chance to ask a Black doctor, people who looks like them and have had similar life experiences. You get a chance to ask questions. Now, when we started it, we weren't going to be talking about COVID. We were going to be talking about hypertension and diabetes and colon cancer. But COVID came along, and it was a perfect platform for us to talk about it. And so we've had so many webinars where we've talked to different organizations about it. But again, that's not going to change that 25-year-old, that 26-year-old who just says, I'm not going to get it because I'm healthy. We're going to have individual conversations about that. Any opportunity that we get to talk about it, I mean, there's so many partnerships that we can do.
And speaking of partnership, I want to say this because I think it's so important we understand that the African American community is heterogeneous when it comes to talking about religiousness. So I say that to say this, for us to understand that it's not just a Christian kind of conversation that Christians we need to be talking to. We should not exclude our Islamic brothers and sisters. We should not exclude those who are practitioners of African traditional religions and other things. And that's why I love your question about what are some of the underlying reasons that could lead to infection. Because what that does, that opens the door for us to have a conversation about this that's not just rooted in one religious tradition. Right. You know, we can find a common moral principle that we all agree upon, and we can have the conversation, we can ground it in that. For example, we're talking about what happens if I don't get, is inoculated the right word? I don't get vaccinated. That's what I'm thinking about, vaccinated. Then does it mean then that now I become a risk to the entire community? So why not think about, what is my responsibility to my people? And let's use that to frame the conversation and perhaps take religion and put it someplace else. Maybe that might be helpful. Right. And maybe that can undermine this rate of our not being vaccinated, because Georgia is high on the level, or when it comes to the percentage of people who have not been vaccinated. I think Georgia is one of those top states. Yeah. And that's not good.
It's not.
And I think you're exactly right. And that's one of the things that has bothered me about this whole pandemic. And we went through two pandemics at once, the racial pandemic and COVID. But I never thought we would have had a problem with people listening to their doctors. Yeah. I never thought we had, and especially for something as simple as wearing a mask.
Right.
And washing your hands, and at the time staying at home and staying away from people. And what disturbs me about it is because to me, it seemed like it was a very selfish act that people were doing. Mm-hmm. Yes, politics played a big role. Politics played a big role. Yeah. But it's also very selfish. And the one thing that I thought that we would never have a problem with is when it came to a disease or pandemic, that we wouldn't listen to our doctors. And that's exactly what has happened. And I do want to get back to talking about the trust issue.
Yeah.
That's big.
That's huge.
That's big.
That's huge. And we absolutely have the right to distrust physicians and healthcare system as a whole. Right. Absolutely. We have so many examples of why we should distrust them.
And since we've already brought it up, so can you explain, the two of you, with what you know from history, like why do we as a community have so much distrust in these medical practices and even with vaccines?
Well, I can just say, the classic case, everybody talks about the syphilis issue.
In Tuskegee, right.
That syphilis experiment, is that the right term to use?
Right.
There at Tuskegee, and that whole phenomenon where they took the body of an African American woman, and used it, and I'm kind of I can't remember her name. Henrietta. That's it. I remembered the whole case, but I could not remember the name. And I do know that those two are kind of like the paradigmatic cases of how medicine viewed Black bodies as items to be manipulated, to be tested, to see how much pain they could endure, and you know, it's hard to get that out of our minds, and I do know that that's probably one of the bigger issues, you know, when it comes to trust. That's key.
Yeah.
You know, I don't know. I think it would be irresponsible to try to take that off the table. Again, the medical apartheid book is the book that, again, the document that lays a lot of that out, and I'd like, you know, to put that in play and we could actually take a look at it. But I do think those are two of the reasons, or two of the cases that are often cited when it comes to why should we distrust.
What are those safeguards that scientists are using to make sure that our minorities, you know, individuals that look like us, are not being experimented on again?
Well, fortunately, based on some of those things that we talked about before, there were several laws passed that made it illegal to do some of the things that were done then. But as a synopsis, I mean, there's certain phases, you know, whenever a drug is discovered or whenever a procedure is done, there's certain phases that you have to go through. Usually phase 1, phase 2, and phase 3, and each one of those represents something different. And so in order to get through those phases, you actually have to have a certain number of minority representation. In fact, they were gonna have to stop the trials if they didn't have enough minorities to participate. I don't know if y'all remember, they were asking people, they were begging minorities to come and be part of the trial. And it would have had to stop if there weren't enough minorities. And so that's something that we need to be a part of, not just for COVID, but in the different trials. That's something we need, even when it comes to medications on hypertension and diabetes. We need to be there with the seat at the table so that we can see what happens to us when we take the medications, when we do a certain procedure. And so, yes, there are certain rules and guidelines in place now that pretty much assures that you have minority representation when it comes to certain medications or treatments.
And see, I think about this also from a different kind of angle. And the line of attack, I think, would be to continue making the case for how appropriate getting the vaccine is. There are some who are saying, you know what, it's wrong to require us to have this in order to go back to school. But I'm thinking, okay, let's think about it a whole nother way now. Keep in mind that you're going to be in community. Keep in mind you're going to be in a situation where you could possibly be, as Frank pointed out, asymptomatic. But you know, perhaps you can, if you're asymptomatic, can you still spread? So again, what we've got to do is we've got to put in place more conversations where people can understand the importance of or the role that I can play in either raising the chance that somebody else can be, you know, infected, or reducing that kind of thing. So it's a matter of, again, building upon something that, especially at Morehouse, that we're really big with advocating for personal responsibility. And it's a matter of realizing that, hey, it's up to me to stop some of this stuff. Just like in our communities, it's up to us to make our communities better. Here at Morehouse, we teach how important it is for us to become responsible, you know, moral agents for making our community stronger, better, smarter, more enlightened. And that has to be embraced. And I think we're on our way towards doing it. But I do think it's going to take some work. We're going to get it done, though.
Right, definitely. So
one of the other things that's very important that we have to fundamentally do, which we're doing at Morehouse too, is we have to put people in positions so that they have a say-so. So when it comes to creating more Black doctors, when it comes to creating more Black biomedical scientists and social scientists and public health professionals, we have to be there. And so there is, you know, with the one of the vaccines that was created, there's a Black female that is leading the laboratory where it was created, Dr. Kizzy Corbett. You know, so not many people know that there's a Black female that really was very responsible for that particular vaccine being created. And actually, in the other laboratory as well, there's another person, Dr. Judith Absalom. And so those are we have to put ourselves in position. So we, even starting at a young age, we have to create people that are going to be in positions to help us solve our problems.
And see, again, I love this conversation because what I'd like to do, I like approaching this from the same kind of question, again, taking another line of attack, another way of looking at it. And I'm saying it to say this, that like here at Morehouse, putting these guys, and I'm literally saying guys because, as a gentleman at Morehouse, not trying to be sexist, but right. Having brothers who are going to sit with brothers who are in sociology, who are in biology, who are in philosophy, who are in religion, and brothers who we're sitting here, we're thinking through this, and we're saying, okay, what we're going to have to do is sculpt a hermeneutic, a way for thinking about moral decision making, and thinking about our bodies, and thinking about these kinds of things that will be liberative, right. that will help to empower us. Because I will tell you, at the end of the day, medicine is I personally think that if you're going to opt to believe that the holy exist, and the holy exist as a God, and this God is all powerful and all that, then I'm trying to figure out, why would you then exclude medicine from being one of the avenues through which the deity operates? And so I think that by being here at Morehouse and having these kinds of conversations, it can help expand our thinking, and we can see the possibilities, and it will empower us, and it will help us to even get rid of the mistrust, because you know what? We have some good information. Right. And I think that is so important, putting out good information, and that will help us to develop, our theological kind of muscles where we're wrestling with issues.
Definitely. And like on this topic already about representation and like the roles, we've talked about it a little bit, but like how do Black physicians and those who are working with the vaccine and just in general, how does representation play like a bigger and better role with mobilizing the vaccine?
It plays a huge role. And again, because in general, people trust their physicians. Yeah. People trust their pastor or their minister or their bishop. People trust the teachers.
Right.
And so you have to, people in general don't trust politicians.
No, they don't.
They don't.
So you got to get the trusted people in the community to go out into the community and talk to people and convince them that they need to get this vaccine to save their lives and to save their families' lives. So there's been some talk now about going house to house, because most of the people that wanted to get the vaccine in the beginning have gotten the vaccine. Yeah. Initially, it was a supply issue. There was not enough supply to get it. It's not a supply issue now. You can get the vaccine today. If you say I want to get the vaccine, you can go and get it
right now. Right.
So the people that we're trying to get the vaccine, they don't want it for several different reasons. And so we have to be able to talk to them. I've been fortunate enough. I've had the opportunity to talk to several people on a one-on-one basis and answer their questions. And some of their questions are pretty out there. I think we're probably going to talk about some of the myths later, but they talk about some of the chips being placed in people. They talk about other diseases that you're going to get.
I heard that.
But when you talk to people one-on-one about that, you're able to answer their one-on-one questions. I was fortunate to be able to talk to a group of young men here at Morehouse a few months ago who just happened to be joining the greatest fraternity, Makes Psi Phi Fraternity Incorporated. I had to get that in there.
Okay.
But I had a chance to talk to them, and they're guys that were going through the process. And they had so many great questions about the vaccine, but I was able to talk to them and answer their specific questions.
Right.
And so that's what it's going to take, being able to answer specific questions. And I think what's going to eventually happen is once we get the vaccine into the doctor's offices or into the local pharmacies, and you have a chance to go up and talk to your doctor, go up and talk to your pharmacist or your school nurse, I think we're going to see a lot more people be willing to get the vaccine.
So, and understanding more of like how useful to get the vaccine is, can you talk about the facts of the vaccine and like the pros and cons of why you shouldn't get the vaccine?
Mm-hmm. I think the first thing that we should say is kind of going back to what we said before, that if you get the vaccine, you are highly protected from getting very sick and from dying. Over the last several weeks, 99% of the people that have died have been people that have not gotten the vaccine.
Yeah, that's what I read.
So that should say a lot. But there are 3 types of vaccines that are available in the United States right now: the Pfizer, the Moderna, and the Johnson & Johnson. The Pfizer and the Moderna are very, very similar in a lot of different ways, but they're what we call messenger RNA vaccines.
Okay, now put the cookies so we can get them.
Okay.
Some of us don't understand that. Yeah, tell us what you mean by messenger RNA
Okay.
vaccines.
Okay.
vaccine.
So I like to think of it, messenger RNA, I'll tell you what it is first, and then I'll tell you how I like to think of it. What it does is it provides information to the cell, and the cell creates these proteins called spike proteins.
Okay.
Then the body can recognize the spike protein and develop immunity to it.
Right.
Okay, that's the scientific part of it. I like to think of it like, and people always ask the question, is it going to affect my DNA? Mm-hmm. Right. Well, the messenger RNA never gets inside your nucleus, so it does not affect the DNA. That's one of the big myths. It does not affect your DNA, okay? Think of it like DoorDash. DoorDash will come to your house,
Drop off your food.
bring off your food, drop off your food, but they don't come inside and sit at your table and eat your food. They don't do that. They drop it off and leave, and then you consume your food. So, that's just a kind of a rough way of thinking about it. So the messenger RNA, and then the messenger RNA, once it does its job, it gives the cell the blueprint, then the messenger RNA degrades and you never have it anymore. But what it does, it causes the body to create an immunity, and there are different types of immunity, and that is long-lasting immunity.
Right.
Okay. In terms of how long that immunity is going to last, there have been lots of discussions about that. Right now, the initial papers that came out said it lasts about 6 months. There have been some other papers that have come along that says it may last a little bit longer than that. So people may ask, well, if I've had COVID and I'm immune, do I need to get the vaccine? Again, that's a question we can't answer completely, except that we don't know how long natural immunity lasts either.
Right.
And we don't know if it's complete immunity. So we said if you've had COVID, that you need to wait several weeks or about 90 days and then still get the vaccine. Okay. So those are messenger RNA viruses.
But see, and then my question would be, well, I actually got a couple of questions.
Mm-hmm.
But Frank, question I'm thinking about when I heard you say that was, after the initial kind of efficacy wears off, then, the booster shot piece, do we have to go back and get booster shots? How frequently do we, is there any kind of data on that? What would you advise as a physician for a brother, who's had, or a sister who's had both of her shots? What would you say about this booster thing? Would you, is it something that's going to become the case?
So that data is still being collected, and that's very important. And so I think us as healthcare providers, we need to tell the community right now that we don't know the answer to that.
Okay.
But they're investigating it, and we should know that soon. So there is a chance that you may have to get a booster shot. So we need to tell the community that now so they won't be surprised. If we say, oh, no, you're not going to need a booster shot, and then you end up having to need a booster shot, again, that's just going to cause the community to not trust us. So I think we need to be honest and say we don't know the answer to that. There's a good chance that you may have to get a booster shot, just like we do with the flu shot.
All right. Okay. And understanding that, do you think what do you know about the vaccine and its work against the Delta variant that's been going around recently?
So one thing to know is that all viruses mutate, and that's what a variant is a mutation. And that's what the viruses are trying to do. They're always trying to mutate. They're always trying to change it up a little bit because the only way they can infect somebody else is to change it up a little bit. And so right now, the information that's coming out, there actually was just some brand new information that came out today or yesterday from Israel looking at the Pfizer vaccine again. So it was like 95% effective, but with the Delta variant, the effectiveness dropped down to like 65%. That's a huge drop.
It is.
That's a huge drop. And the variants are more contagious. than the other initial virus. And so that's why it's so important for people to go ahead and get vaccinated, because the more people you have that are not vaccinated, that's the more possible mutations and the more contagious and the more dangerous the vaccine can get. If you only have like a pot of 50 people, or let's say even 10 people that have not been vaccinated, chances are that mutation is not going to be that bad. If you got thousands of people, you know, there's just thousands of opportunities for the viruses to mutate. And so that's why it's so important with these new variants, while we have vaccines that work, we know they work. So that's why it's so important right now. This is our opportunity to get people vaccinated, because the more people, the longer we go, and people don't get vaccinated, we start mutating, and then we find out, wow, now it's not working against the mutations. We're gonna have to start all over again.
Yeah.
Everybody's gonna have to get vaccinated all over again.
So you're about another possible shutdown again if
all of that. Some people are now even wearing the mask again because of this Delta variant. People are wearing, in California, in Nevada, and some places, they're saying you need to wear your mask again because we don't know exactly how effective it is. But the studies right now are showing that it's still pretty effective against the variants for now. So it's really a race against time.
Definitely. And moving forward with that, who would you advise to get the vaccine? And should our viewers be getting the vaccine? And beyond that, also, who should not get the vaccine?
Great question. In my mind, there's, everybody should get the vaccine unless you have an allergic reaction to some of the contents of the vaccine, which is rare.
All right.
And if you're in the middle of getting some types of immunosuppressive treatments or something like that, then you probably should wait to get the vaccine. Other than that, though, pretty much everybody should get vaccinated. Right now, it's available. Pfizer is available for children 12 and older to get the vaccine. But they're doing the studies in children as young as 2 years old. And hopefully by September, it's when we're thinking that small children may be able to get the vaccine. But we get questions all the time. Well, I have asthma, I have diabetes, I have sickle cell. That's exactly why you need to get the vaccine, because you do have these comorbidities.
Right.
And if you catch COVID, it's going to hit you even worse.
Right.
And so I think really everybody needs to get the vaccine.
Definitely. So now for the moment we've been waiting for, myth debunking. I have 7 common myths about the virus and what they're doing or what they're not doing to people in the community. And I wanted to get your expertise on what they or how they're being debunked and what's wrong with these myths. So myth number 1, getting the COVID-19 vaccine gives you COVID-19.
It does not give you COVID-19, and that's been proven because of the way that the vaccines are delivered and because of the mechanism of action. In the old days, they used to give you live viruses as part of a vaccine, but that's not done anymore. So you will not get COVID by taking the vaccine.
All right. Myth number 2, I'm young and healthy. I don't need the vaccine.
And that's really one of the main reasons why you need to get it, because young and healthy people are out in the community with other young and healthy people.
Right.
And so they need to get the vaccine, and they may be asymptomatic. And so they need to get the vaccine so they won't spread it to other young, healthy people or to children. And so that's one of the most important populations of people that need to get the vaccine.
Right.
Just to tell you a quick story about my sons, I have a son that's 24 and one that's 19. They see me doing these webinars all the time, and they were absolutely against getting the vaccine. But they're very much into hip hop music and very much into sports. And when they found out they weren't gonna be able to go to certain concerts or go to certain sporting events, they decided right there, I'm gonna get the vaccine. So they are both vaccinated right now.
Right.
So it's very important. But the other very important thing about that is this called long haulers syndrome or long COVID. You may be fine right now, but down the road, there are lots of symptoms that can come about. It can affect your heart. It can affect your brain. So many things that can happen to you down the road that are not even happening right now. And so that's another reason why you need to go ahead and get vaccinated, because it can affect you much later in life.
Myth number 3, I don't need the vaccine because I've already caught COVID.
It's possible that during, immediately after you've had COVID, that you don't need to get the vaccine. I mean, that can be debated. But again, we don't know how long COVID lasts. We don't know if there's complete immunity from the vaccine or not. And so the recommendation is wait a certain period of time, usually about 90 days until after you've had COVID, and then go ahead and get the vaccine. So again, that's something that is debatable. And we use part of the people that have had COVID, we're trying to talk about herd immunity. We need to get up to about 70, 75, 80%. So we're including some of those people that have had COVID in that herd immunity thing. Mm-hmm. But I still would say the safest thing to do is to go ahead and get the vaccine.
Definitely. Myth number 4, COVID-19 vaccines will deliver a microchip into my body.
That is the one to me that I just cannot seem to explain to people, because people get their information from the internet now, and there's so many internet stories about COVID-19 and a microchip.
Right.
So I had to go back last night and try and find out, where is this coming from? And I'm not gonna call out the person, but it's a very popular person who has a podcast, who's on all the time. And what it says, he was just joking when he said it. He was joking. But when other people heard it, they were like, he's not joking. And then it's something that he just kept running with. Oh yeah, you're gonna get a pot, they're gonna put a chip in, So I think it's up to that individual to first get educated and understand that it is not a microchip that is going into your body. And he has millions of people that listen to him and his radio show. And so I think it's up to that individual to get educated and then to debunk that myth. And you will see so many people that will then go ahead and get the vaccine. He's hurting our community because a lot of people believe that they're getting chips placed in them. Mm-hmm. And just one other thing, people are afraid of chips because they say, well, they might find out information about me. Every one of those people have cell phones.
There you go.
And it's not a bigger chip than a cell phone.
Yeah.
And you carry your cell phone around with you everywhere, and anything that people want to know about you, they can get it from your cell phone. And so even if they were putting chips, they're not putting chips. Yeah. But even if they were, they already have information on you through your cell phone. So for all of y'all that think they're putting chips in you, they are not putting chips in you.
I'm with you.
I've had both of my shots and I ain't got a chip.
Right.
The overriding thing with that is where people are getting their information from.
Yeah.
Unlike when we were growing up, we got our information from 3 or 4 reliable sources.
That's true.
Now you can get your information from everywhere.
Right.
And some of the things that are out there are just crazy.
Very true. Very true. Myth number 5, the COVID-19 vaccine can affect fertility.
It does not affect your fertility. And what they found that out because a lot of people that were in the trials actually got pregnant after they got the vaccine while they were in the trials. And so they had very normal babies, no problem, males and females.
Well, what about the sperm count in brothers? Will it reduce your sperm count?
It does not reduce the sperm count.
How you know?
They've studied it. Okay. It does not reduce the sperm count.
Just checking. We're talking fertility. I'm trying to make sure we're not just focusing on
I don't know personally. They didn't check my sperm.
Does it reduce your sperm count or whatnot?
But no, there have been studies that have shown that it does not reduce it.
That's what I want to hear.
But particularly with women and fertility and breastfeeding is another one. I mean, yes, you can breastfeed after you've gotten COVID. And actually, some of the antibodies are spread in the breast milk, so that's protective for the child.
Right.
But the 3 leading organizations that deal with, the American College of Obstetrics and Gynecology and those types of organizations fully support women getting vaccinated. I mean, there have been no studies on women or men to show that it affects fertility.
And then along those lines, myth number 6 talks about the vaccine is going to alter my DNA and that the government is experimenting on the public.
It is not going to alter the DNA based on, again, the mechanism of action. And we kind of talked about that earlier. And that the experimentation goes back to the trust issue. And so we have to, when I say we, the healthcare system has to earn the trust of the community. We have to earn it. Now, it is up to us as individuals to educate ourselves too. Mm-hmm. So we have to educate ourselves and get as much factual information as possible. But it's also up to the healthcare and the medical community and others, community engagement organizations, to earn the trust so that people will trust you when I say it's safe for you to get the vaccine, that they'll go ahead and get it.
Definitely. And the last myth that I have for us today is I won't need to wear a mask or maintain COVID precautions like social distancing or frequent hand washing after I'm vaccinated.
That's a very interesting one, because as we mentioned earlier, now some people are saying because of these variants, you need to continue to wear your mask. And so, most public health officials say that in certain areas, it depends on where you are. Mm-hmm. If you're in a highly vaccinated region of the country and the prevalence of the disease is very low, then you don't have to wear your mask like someone who is in the Southeast, like here in Georgia or in Alabama, where there's a high... Mississippi. There's very low vaccination rate, less than 30% of the people. So there's still a lot of disease here. And because the variant is here, if you're going out, if you're indoors around a lot of people, you need to wear your mask. Mm-hmm. You need to socially distance. That's just common sense, Until we've wiped out and until we've conquered COVID, you need to use your common sense.
And I would even go as far as saying there are so many reasons you should wear that mask. Now, when you just raise this issue about the 30% kind of level of people being vaccinated and whatnot, and a lot of elderly people, who could very easily contract or could easily catch COVID-19. Think about a lot of churches. A lot of churches have a very high population or demographic that's senior citizens, and so you got to be careful with young people going in and not wearing masks and whatever, because you mess around, something like that happens in a church or a mosque or whatever, things could get out of hand real fast.
Mm-hmm. And that's where and I hate to even use the term, but that's the only way I can see it, the selfishness of not being responsible.
Right.
If you have grandparents, if you have small children, if you have people that are sick around you, you need to be protecting them. Mm-hmm. And whatever that protection is, whether that protection is avoiding them, whether that protection is making sure you get vaccinated, whether it's wearing a mask, whether it's all of those, it might be all of those. You need to do what you need to do to protect yourself, your family, and the community.
Beyond just providing a space and the shots is the information as well. And the trust, like even some individuals in our organizations or even at Morehouse, we're requiring it, but like how many people on faculty and staff, or even the president himself have actually uploaded their card to Medicaid or have actually received the vaccine. Like you mentioned, the individual at the radio show said it's a chip. If he then comes back and says, I actually have my shot, haha, joke's on you guys. Like that changes the dynamic for a lot of people. Completely. So for the churches, it's like if my pastor is willingly open to be the one to admit he has it as well, then I'm pretty sure people would follow suit.
I'm just curious, like your friends, your colleagues, your frat brothers, what are they saying? How many of them have gotten vaccinated?
So I'll say I know majority of mine have. There's some that I just found out haven't, and they still expect to get on school grounds, but with an exception. And I'm sitting in the same meetings with everyone talking about putting it on Medicaid, and they're telling me what it is and what it's not. And I'm like, well, I'll tell them. And my alarm brother's like, talk to him. But I'm like, you already said something. So will I really change his mind? So that might be on me to speak up to him again. But, you can, as they say, lead a horse to water, but you cannot make it drink. So it's, I would say majority of my friend group have definitely gotten their vaccine because they understand we want to participate back in life. Like a lot of us have had our college experience shortened in other aspects. Some of us didn't receive a traditional experience with a lot of different things. And it's just like we want to get back to normalcy. Others, they're like stagnant on what they want to do. They don't want to get a vaccine. They don't think they need it. They're like, I don't trust it. They don't do due diligence to figure out what it is, why you should get it, why you shouldn't. If you even should, they just come up with their own ideas. So I think majority of the students are reluctant to get it from the numbers as well. So
do they mention some of those myths that you asked about?
Yeah, I've actually heard the DNA one before, and a lot of people really, it's just the medical mistrust. But the thing is that doesn't make sense to me is, they don't know the stories.
That's what I was gonna say.
All they know is the names. Like they just heard of Henrietta Lacks. They probably heard it because we talked about it one time in class, or they heard it from somebody like me who actually had to possibly study it in class as well, or they just heard it on TV. Like they don't know what happened. Like if I bring up the syphilis experiment, and I just sat in the room, I really would like to see how many people would know that happened at Tuskegee, and like it had nothing to do with the global airmen or nothing like that.
Right.
Like it had Tuskegee, you know, and like what actually happened and like that type of thing. So it's just funny to see a lot of people just take some things at face value that they should probably question a little bit more.
And I've actually asked that question. You know, when people mention that, I've asked them, well, do you know what the Tuskegee, but I don't want to make them defensive.
Yeah, right.
You know, I just really want to know, do you really understand it? Because I want to be able to explain it to you.
Yeah, exactly.
You know, but a lot of people don't, they use that, but they don't really understand it. I think a lot of it is fear.
Yeah.
A lot of it is fear. So,
fear that unknown.
So get your questions answered.
And my only thing is, and that's maybe another way to frame the vaccine, is people are afraid of getting it because of the unknown, but we should also be afraid of not getting it because we don't know what's gonna happen. And it's similar to how maybe different religions frame salvation. You know, some frame it off if you don't, you don't know where you might end up, or you do know where you might end up, or however you want to say it, but it's still like you don't know the unknown and you're afraid of what could occur. So it's like, a lot of people don't like that approach, but it has done numbers for some people, Like why not just go, how they say it, the safer route, just be safer about the decision.
The thing
that's a very astute remark that he made. He must be a Morehouse man.
chances are he's probably trying to figure out how to study with me. That's what it is.
Yeah, you must be a Morehouse man.
But what I'm going to say is this, that what we've got to do, and I like the line of argument that's in play about the importance of information and trust. And I think having good information is so critical to this conversation. And I would hope that pastor, whoever he or she is, that when he or she, whoever the clergy person is, whether he or she, he or she is doing, that person will make sure that they're putting out the best information possible, and they're distributing it, they're making it readily available, this kind of thing, so that people can make good decisions. Because I firmly believe your judgment is no better than your information. I really believe that. Your judgment is no better than your information, and I hope that the clergy person, the care provider, whoever he or she is encouraging his or her parishioners to use their brains and not put their brains in their back pocket when it comes to trying to be a religious kind of agent. So I think then that I'd love to see us go in that direction, and I think that's one of the things that can help serve as a myth buster, because I love those little rapid fire things you had going there.
Right, definitely.
And what I like to, I'm not trying to scare people. Either you get the vaccine or you get COVID.
Right.
Because eventually you're gonna get COVID. Until we totally eradicate COVID from the community, eventually, or I can't say 100%, but chances are at some point you're gonna get COVID. And especially if you're in a college environment like this.
Yeah.
Or even just in a natural environment, chances are if either you get the vaccine or you get COVID.
Is the idea of freedom sometimes becomes less of an actual idea, and then we consider it more of a privilege. Like the idea of enforcing a vaccine is also upon the school's rights to do.
Absolutely.
But a lot of students are like, well, I go to this institution, or a lot of alumni, I've went to this institution. They believe they have some say-so, and they're more of a stakeholder, which they are, but also they don't necessarily live in the general community. When the virus came, everyone had to go home. And if you think about it, your home wasn't Morehouse at that point. It's always a home for you to come back to. But that's the idea. We're reuniting back to this institution. So I think with moving forward, it's understanding that your freedom is not only affected upon you, but others as well. Like you talked about, that selfishness or being selfless, and understanding that you're coming back to this community, coming back to the city of Atlanta. There are individuals in this area who don't have the same access that you do. So you're bringing back, if you're not vaccinated, you're bringing back some things that might not just affect you, but everybody, so it's bigger than you.
Absolutely. And that's the message that needs to be spread. So important that our community has to take, responsibility upon ourselves to educate ourselves and to motivate our people to go and get vaccinated.
Students, faculty, and staff of Morehouse, be sure to upload your proof of vaccination or an exemption request through the Medicaid application in My Portal by July 30th, 2021. Visit the website on your screen for more information regarding Morehouse's COVID protocols. Feel free to contact the Student Health Center at shc@morehouse.edu or hrcovidinfo@morehouse.edu if you have any questions. Be sure to like and follow Morehouse College on Facebook, Instagram, LinkedIn, and Twitter. Stay up to date on daily news and happenings within the college. Please stay safe, stay informed, and stay tuned for the next episode of Illuminated by Morehouse. Thank you for watching.